Thanks for joining us. You want to introduce yourselves again?
Sure. Want to go first?
Sure. I am Carly Aldis, and I am a licensed clinical social worker. I work with children and families with mental health concerns.
I'm her husband, Danny Aldis. I'm an occupational therapist, and we own Revival Therapy. So we work with primarily kids in the foster care system and kids who've experienced a lot of trauma in their life. So,
and I think you're the first recurring guest we've had on the show, so we really appreciate that.
I invited myself back on, so you're welcome.
That's right.
No, we love it.
Anytime. So you told us that you were doing some more looking into some new topics that you wanted to bring up today.
Yeah. Well, first off, I wanted to bring up it's kind of I'm the problem guy. Like, I'll see stuff and I try to explain it and I do the research. A lot of times I'm not helpful after that. So then Carly's more of the solution girl. She is going to do the more of what we do about this. So part of the topic we want to talk about is just being a trauma-informed agency and what that looks like and how trauma actually impacts our healthcare system and individual through the lifespan. So that's kind of what we want to cover. If you just want me to jump into it, I can kind of start off.
For sure.
Did we talk about the ACEs score last time we were on here?
I don't think we did.
I think so. Okay.
Let's go ahead and recover it though, just in case for the listeners.
Okay.
Definitely.
Okay.
Okay. So ACEs was primarily developed, I think, by therapists, but more importantly, it was actually utilized by insurance companies as a way to kind of screen how much liability are you going to be. And ACEs stands for Adverse Childhood Experiences. I don't believe they do that anymore just because it's kind of giving you, kind of punishing you for the trauma in your life. So I don't necessarily know if that's the most ethical thing, but what it is they found that the higher number, it's a screening, and there's 10 questions on it. And the more of these questions you answer yes to, it's literally the more likely you are to suffer from it throughout the lifespan. So it's adversive childhood experiences. So the more yeses, you're more likely to suffer from lung disease, smoking, cardiac conditions, obesity, depression, suicide, anxiety, substance abuse, smoking, incarceration, HIV, coronary artery disease, and cardiac conditions. And the list just goes on and on and on. So what they found was these individuals throughout the life just had a way more difficult time. And typically when you think of trauma, you think of maybe being involved in a robbery or a car accident or something like, or severe physical abuse, which is true. But I wanted to read a couple of the questions on the screening to kind of give you an idea of what trauma can also look like, which really surprised me. So one of the questions on the ACEs questionnaire is, did a parent, and this is while you were growing up during your first 18 years of life. So did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you? So if you were to answer yes to that, that's already one trauma point, right? That's one ACE point. Another one would be, did an adult or person, ever sexually abuse you, physically abuse you? Did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? And the one that really surprised me was this, which is it's pretty rampant in our culture. This one is a point as well. Were your parents ever separated or divorced? Which is very common these days. And that's actually another point. We typically see a huge jump at susceptibility for health concerns when we reach 4 to 6 ACE points. That's when we really see these conditions later on in life becoming way more severe, and the likelihood of them happening becomes a lot higher. So I don't know if you guys had questions about that, but those are just some of the questions. Well, I think I did 3 or 4 that actually predict a lot of the difficulties in life later on. So I found that crazy that it was that big of a predictor that insurance companies actually use that, because if they're doing it, they want to save their money. So it's obviously very data driven. There's tons of research to back this up as well. So
Was that a newer thing, or they just started using that recently?
no, they've been,
I think it was 1980s and then they stopped it. So they started really even just looking at trauma pretty recently as to the correlation between, like trauma and physical ailments, because it used to not even be looked at. So in the 1980s, they started using this. And then I think in the latter part of 2000s, like they stopped and said, wow, we can't do this because we're affecting people that have had trauma, and now we're saying we can't cover them. So it's interesting.
Did they change that or move on to another way of ranking things?
Yeah, I think now a lot of times, like if you see insurance companies, they do kind of like a health screener now of like, have you done this, or what is your weight, do you smoke? And so I think that's what they're using more, is just more of like a physical.
Yeah. Well, I think what's going on too is the mental health world is pretty on to this at this point, to a point where I think we're very trauma aware, meaning, we hear words like safe space and trigger happy. And I think the mental health world has overemphasized trauma, which it should be, at least to bad things, but they've really, in a lot of ways, not put a lot of emphasis on resilience. So we have the trauma problem, but then we typically don't talk about how awesomely we were created and how we were designed to be able to deal with trauma in many ways through resilience. So when you have that much of a leaning towards trauma, people tend to not really have a whole lot more coping skills to deal with it, just simply because, well, if you have trauma, it's like, okay, well, you've had trauma, and that often becomes who you are. Whereas if we start educating more on, you've had trauma, here's the skills, and here's how resilience works, that's kind of what we want to emphasize in the mental health field. Whereas the healthcare field, trauma is not even a factor. You guys know, being in the healthcare field, we're very symptom based. What's wrong with you? You have this, let me give you this pill. We often put band-aids on bullet wounds. We are symptom based without lifestyle change or recognizing the underlying factor. So I think that for the healthcare field, it's important more so to know about trauma and what it impacts, because if you have had a traumatic experience, it physically reorganizes your brain, right? Because we're in that fight or flight symptoms all too often. So that's essentially what trauma is it's throwing off your homeostasis, so you're consistently in fight or flight, which has an impact on everything from your sensory system. So if I were to back up our neurology, right, we have these underlying factors that help us with resiliency. One of those being neuropeptide Y, which is a neuroprotein. During a stressful event, that actually gets released, and it's a protective response for the brain. So it helps us cope with stress. Your main stress system is actually a negative feedback. So it's called your HPA axis. And this is just kind of the neurological nerdy part of it. Is this system involves your hypothalamus, it involves your pituitary gland, and ultimately the destination through hormones is to hit the adrenal glands that releases the stress hormone cortisol. And then in a typical person, once that cortisol is released and it hits a certain level, that negative feedback loop stops the stress, right? It stops the cortisol. It shuts it all down, meaning cortisol increases your heart rate. It increases your blood pressure. It brings more blood to your organs so that you can run quickly and think faster, like that. Like if you were to see, I mean, there's a million examples. The typical ones, evolution. We see a lion, it's close to us. We get that burst and we run, and then we go back to normal, right? We're safe. But when you get a constant stream of cortisol, you become kind of tolerant of it. and that's what we're seeing is that constant high rate of blood pressure and constant heart rate and all the other things that come from that gets us in a very unhealthy physical state. So we're seeing that long-term sympathetic state, fight or flight, just wreaks havoc on the body. So being a trauma-informed agency would refer to you have a traumatic experience.
And when we talk about traumatic experiences, it's not, I mean, a lot of people, when you hear trauma or PTSD, you think of like war veterans and people
Right.
coming back from war and that kind of thing, which obviously they have PTSD, but in the field that we work in, mostly with pediatrics, we're looking at early childhood, things that happen during early childhood that sometimes our brain actually forgets. So a lot of like yelling, domestic violence in the home, abuse, being separated from a parent. A lot of our kids are, in foster care or have been moved around a lot or adopted out. And so all of those traumas, then when we're adults, we don't really recognize that those things have affected us at that level. And so that's what we're talking about when we talk about trauma. There's so many different things. And it's really how your individual brain processes that information, right, at the time that it does. Some people can go through the same thing as somebody else, and it's not a traumatic event to one person, but it very much is to another one, depending on their resilience and their attachment and connection and community. So that's what we're talking about when we say trauma.
Can you talk about resilience? Because that might be another definition you guys can talk a little bit more about. Like, what does that look like, and what is that defined as?
Yeah, I mean, resilience. So one of our big things that we talk about so much is just connection and community. I think resilience, like being able to overcome traumas, being able to overcome things, is really that connection with people, right? Like having an attachment with people in your life or a group of people that you kind of do life with, right? Having a primary caregiver. So a lot of times with our younger kiddos, they don't have someone that they trust ever, and so getting that primary connection, faith, hope, doing all of that, and wherever that comes from. And a lot of people that are more spiritual and that have that hope and faith tend to be more resilient in community. What else did we talk about with that we're seeing is like some of the
in the therapy world, we have like the mental health world narrative, right? So they did a study with a bunch of Holocaust survivors, and part of it, a big part of their resiliency later on in life, getting a job after the Holocaust, really building a family, things like that, was a narrative. They changed the narrative from obviously such a horrible situation that was doom and gloom, which it was, to it actually having a purpose, right? What was the narrative? It made me stronger. I was able to survive. And that narrative is crucial. That's one of the biggest component of resilience. That and the neurochemistry of it, we are built to be okay. People forget that. People are extremely, and I feel like we're in a that's being ignored a lot lately, that people are extremely resilient, through and through. So that was one of the biggest ones when you read a study about, I think it was 130 people in the Holocaust. A huge percentage of them ended up functioning pretty good. So
how you look at your situation and how you exercise your brain. So a lot of things that we do in the mental health world are taking you down a different way of looking at things, right? And a different way of what came out of that experience, or empowering you in that experience. So what are things that your body did at that time to protect you, instead of the overall trauma of it? So just perspective taking is a lot of it. And different people's perspectives, obviously, you're more resilient based on your perspective of your situation.
It does seem like that has a lot to do with it, because like you said, two different people could experience the same thing, and then people will run different ways with it. And I think nowadays too, people get really, really fixated on their feelings or what they feel about the event, but I almost feel like that's almost like they're pointing people towards a negative direction where they're trying to get them to keep thinking of something as more of a negative thing rather than a learning experience. Like people get really upset about the fact that something happened, but I think you're right. I think they don't always think of, well, what I learned out of this? Like maybe I could do something to avoid the same thing from happening in the future. But I feel like people aren't being trained to do that anymore. I think resilience is it's not looked at as often.
Yeah, it's allowing people to experience and feel their feelings, right? And then taking that experience and moving forward in it, right? So I think sometimes people aren't allowed to feel feelings, right? Like it's like, stop, that wasn't sad, like you need to move on, right? So we see some of that, and then sometimes it's an overkill of let's keep going back to that, and oh, you feel sad and I'm so sorry for you. So it's definitely the balance of allowing those experiences and not being shameful of those feelings, and then what do we do with them after, so.
What brought you to start exploring this more?
I mean, we've been working in, I was figuring this out the other day, we've been working in poverty for almost 20 years. So I went from working with, we met and we worked with kids with like severe behavior problems in college. And then I went on and became a police officer. And then after that, I became, and obviously with that, you work in poverty a lot. You're always seeing very disenfranchised groups and poverty. And then I went into occupational therapy, and she came mental health. And with that too, we've seen a lot of, I guess, patterns of
like similar patterns.
similar patterns of people who frequently had a high amount of trauma have kind of a similar outcome. You know what I mean? So,
and I think what Danny was saying before, it's what we were looking at as a society, we're very symptom based, right? So the treatment that we were originally trained in just change the behavior, right? It was all an external behavioral modification. If we change the behavior, then there'll be, and we weren't getting to the root of why are they the way they are? What happened to them? What's deeper? And once we were able to kind of explore, well, these things happen to them, and this is the reason for behaviors, and now they can understand it, and now they can move forward in it. So it's just a different approach. And really looking at the brain and trauma and what it does to you physically, right? Because we're all about the holistic kind of approach is, what happened to you affects not only your physical, but your mental health. So it was a cool thing to see some of just the, I guess, neurology behind the trauma.
It's interesting to bring that up too. And earlier, Danny, you said that when people have some kind of a trauma, it can affect sensory as well. We've had patients before that they were getting better, and then they start getting more stressed because of work or whatever else. And then you see their symptoms seemingly getting worse, even though like the range of motion's gotten better, they've gotten stronger, but all of a sudden the same thing seems to be firing up again, but you don't really see any of the other secondary signs of it. So sometimes it could also be that their body's paying a little bit more attention to it now, maybe.
Yeah. So to touch on that, as far as the healthcare field, with trauma, you actually get the nociceptors, the pain receptors, become overly involved, because we talked about how trauma can even impact sensory. So if you think about it, you have what's called a reticular activating system in your brainstem. That's more of the filter, right? It filters out on all the unneeded information. And I'll bring up the example of, let's say you're looking for a Tesla, and then you want a black Tesla, and then next day, all of a sudden, you start seeing more black Teslas on the road. It's not because overnight they made more Teslas. It's because now that system is saying this might be important to you. So let's let all the black Teslas into your conscious, right? So it's the same thing with sensory. It's the same thing with trauma. If something bad happened, you're going to be more high alert for those things. So you're going to consistently be in more of that alert, sympathetic state that ends up, again, throwing you out of homeostasis and putting you into an anxious state, which in turn, has all those health impacts. A big one with that, to me, that I'm really realizing while being at the hospital as well, is we're supposed to do a pain scale because of the opioid epidemic. They said we got to stop issuing these drugs, which clearly was a symptom-based thing. You're in pain, let me give you something. Well, what we're finding is those people are already who've experienced trauma are more at risk to end up in the hospital at a younger age. So now I'm asking them, what's your pain level before treatment, right? So if they say 6, typically we get a nurse and see if we could get pain meds so you can go through treatment or whatever. But that type of pain might not really even be physical. It might not be nerve pain. It might not be nociceptive pain. It could be trauma that also runs the same neurological pathway as it runs through your pain pathway. So that's where we get like somatoform disorder, where you read a psychological state and it gets interpreted as pain. So it's kind of, we're going down a cycle of, we have to get these people out of bed, we got to get them moving. But once again, the trauma-informed approach tells us you might not actually have physical pain. So let's work on the trauma, maybe deep breathing, helping you get through the anxiety so you can get through treatment. And we don't just continue to get you in more of a health risk state. So I don't know if that makes sense, but that would be a trauma approach, saying maybe it's not physical pain, maybe it's trauma pain. So let's do some deep breathing, meditation, some narrative stuff. And I think that would just change the world of the healthcare system if we recognize how impactful trauma is on essentially every part of your being. So
Yeah, it's interesting too, is so one of our friends is a physician and he's in the military, and they've actually been cross-trained in, I think, acupuncture. And he was saying that they were using that for some people that had like post-traumatic stress from some soldiers that they were working with, and some other populations. And apparently they're getting really good responses with some of these different protocols, but in a way you're tapping into the nervous system. And he said that you'll get weird reactions sometimes where people cry or they like sweat a lot.
Wow.
All these
Yeah.
different things that happen. But we've noticed that somewhat too with dry needling as well, is, you might get a real visceral reaction out of the person sometimes, especially if you want to tell them the story about when we were in class.
Oh yeah, so we're learning how to dry needle, and I actually had a knee surgery, and it's still like it's keloided, so it's just like a little thickened. It's healed overall, but to me, or my body or my brain doesn't really perceive it as it's healed. So when we needled the actual portion of the scar, I was like hot, I was sweating, but it didn't change. Again, the temperature didn't change at all, but my face was flushed with blood. Like you can see my face was red. But again, I think that's a good point to what you bring up, Danny, about your body doesn't know the difference between a surgery versus like a traumatic. It's just all in that same brain pathway. Your brain doesn't know the difference between that. It's the way that we interpret that information to perceive whatever that is that we're experiencing. And that can be very different for, how people think about things in general, or just their overall experiences. And that's a good point though, because it does bring along those visceral responses.
And then we've also been using breathing stuff as well for some of our patients that have acute, like maybe back injuries. We've had some luck with helping to sensitize that by getting them in different positions and have them breathe in that position so it feels safe, and you might get a little bit of movement into the area that's bothering them without doing any kind of like aggressive stretching or pulling.
Right.
Yeah. Wow.
So how have you been implementing breathing techniques with your patients?
My biggest one, what I do, well, when I work with my kids who clearly have a lot of anxiety, I actually get them to do controlled body awareness, like gross motor exercises, right? So I'll have them run across the field, run back, run across the field, run back. And what I'm doing is I'm getting their body in kind of state that mimics anxiety, right? So I get their heart rate up, deep breathing, their blood pressure, and then I'll have them stand still with their arms to their side, and I'll walk them through it. I'll do some kind of guided imagery, like this is how you feel when you're upset, da da da. How do we bring your heart rate down? And we'll do deep breathing. We'll do like calm thinking, stuff like that. So that's kind of how I've been working on anxiety with kids, getting them in that state and doing a practical implication of breathing. And then as far as with adults, when I'm working with them in the hospital, typically I have them rate their anxiety from 1 to 10, and then we'll do breathing and see if it goes down. And then I'll usually, because they've had a fall at some point that's really given them that fear of falling, I'll have them breathe, and then on the count of 3, we'll stand up. And I noticed it's been really helpful to implement those coping skills prior to any sort of intervention in the hospital, to get their heart rate down and to get their in like a sound mind state, I guess. But that's how I've been implementing it as far as the healthcare field.
Now, I know that healthcare workers are no different than any other human in terms of the physiology, but how do you think that impacts the healthcare worker as they work with people and as they think about it from themselves? Because there's been a lot of stuff that happened the last 2 years that we probably haven't seen in our lifetime, in terms of, you can name it, deaths in families, and just
Right.
a lot of seen a lot of things that I probably can't even describe with some of the healthcare workers. So could you kind of touch on that, and if that makes sense, clear the question in general?
Oh, as far as how, say that, so like how healthcare workers are coping, or?
Yeah.
Oh, that's a good one.
I think it's important for healthcare workers to process with other, I mean, I think that that's a big thing, is like you said, they're seeing so much, and a lot of it because it's so fast paced. We have a lot of friends that are working in the hospital in the ICU units, and it's so fast paced, and then they just come home and it's just, they're there the next day. So really being able to like talk through stuff, process, teaching the same coping skills, right? You need to breathe, self-care, normalizing that right now this is kind of like the normal for them, and it's sad because they went into these fields and never knew it was going to be like this, right? And just the intensity of it. But yeah, so I mean, the biggest thing on the mental health side is allowing them to process what's going on a daily basis, so they don't feel alone with it.
What are things?
Sorry, mental health professionals are in the same boat as well. They have to learn that.
Yeah. And I mean, I think I see it, a lot of therapists are getting therapy too. It's like almost everybody needs somebody to be able to process on the outside with, just to be able to talk through those experiences, because yeah, everybody's seeing some hard things.
What are you about to say?
I was going to ask about maybe like some strategies or things that you like to ask people to think about things in a different way. Like sometimes I can think about it like you maybe ask yourself a different question, and like asking yourself better questions about how to reframe how you think about something. That's just like a strategy I use in general. But are there, from your expertise, what are things that you tend to do, or things that you advise your clients to do?
Well, I'll touch on okay. So, and Joe, you might be able to, just because of your history, your work history and everything. When I was a police officer, it was completely a sympathetic state all the time. You had hypervigilance, hyper blood pressure. You're always ready to go. So I noticed that once I retired from that job and entered the healthcare field, I couldn't have that same lens, because it came in helpful. You do want to be aware, and you are under threat a lot in law enforcement, and in certain environments you're in. So I had to kind of, and Joe, I don't know if you had to do this getting out of the EMT and all that, is I had to kind of rewire my thinking as well, to not see everything as a threat, right? To not always be in that state of something's crazy going to happen, because that's where my brain was. It's just, you were always experiencing. I had a short track, which is kind of it's a short track to your amygdala, which is that emotional response where you're fight or flight, because my brain goes, you know what, there's a lot of danger going on, let's just always be there, that way we're quick, right? That neuroplasticity was like, let's just go there all the time. And I had to learn to engage my frontal lobe to kind of give it the long pathway, meaning, oh, that guy's not gonna do that. You know what I mean? Like, that person's not gonna do that. This isn't gonna kill me. And then so that way I developed that long pathway, and my anxiety went down, my blood pressure went down, all that stuff, because, you know, that sympathetic state's made for a great reason, but it's our society, Eric, like I said, like the healthcare field, the mental health, we can't maintain this. We can't consistently be in a state of anxiety and expect any good outcome from that. Our bodies are not made for that. So, but sorry, you.
No, I was just going to say we do a lot of, like, for your question, a lot of what we call cognitive behavioral therapy strategies, right? Where we're changing the way that we think about things, which then changes our behavioral response. So some of the questions, like you're saying, that we ask is, what do you have control over? You know, obviously there's so much that you don't. What do you have control over? And asking yourself that, you know, I can control certain things. I can't control that, but what can I control? What's my purpose, and what is the purpose of this? You know, where's my strength in this? What's the purpose of this whole situation, you know, and how can I make it good? And then I talk a lot about gratitude, because I think that if people are focused on gratitude at any level, you know, what am I grateful for in this situation? It kind of alleviates some of the things that we're not so grateful for, right? Or some of the things that we're having conflict with. And so focusing a lot on kind of just that positive mindset of what can be controlled, what we can be grateful for, being present, you know, like walking through a state of just being in the now, in the present, not looking into the future of what's next or what am I going to have to do to feel safe, but just being. And so we teach a lot of that mindfulness, just being in the moment, that kind of thing.
Yeah, I look at this too as you age, sometimes wisdom is also a factor too. So
Yeah.
But I also think as a kid, I don't know if that's anything I would ever think about, you know. So in when you are working with the kids in pediatrics in general, I imagine that people develop this at certain ages, and there's a lot of influences that allow them to think about things differently or ask themselves these strategies. At what point do you think kids are learning how to do this, or like when adults are even learning this process, or is this just like a exercise that you're doing for the rest of your life?
I mean, I think it's training the brain early, right? And then just hoping that it sticks. You know, with kids, we do a lot of play therapy, because that's their primary way of speaking. Sometimes they can't put things to words, but they can play it out, or they can use those strategies through play. So we do a lot of that, and just hope that we're creating, you know, neural pathways that they're going to go to. And we do a lot of work with the caregivers. So we have some really good foster parents, some really good adoptive parents that we're trying to coach, that are learning it for the first time too, you know, but at least they're coaching these kids so that, you know, they see us 1 hour a week, but they're going home and implementing strategies in their home that are helpful. So, I mean, that's the goal, is just training all the people in a kid's lives to do the same kind of protocol, you know. let's all do this.
Could you give an example of how you would incorporate that in play with like using a strategy of that and playing?
Yeah, I mean, we do a lot of games with even like dolls. So I'll have like a big stuffed animal, and I'll say to the kid, you know, does this doll have any pain today? You know, of Band-Aids. And yeah, they have pain, and they'll put Band-Aids, you know, in all the places that have pain. So they don't need to describe the pain to me. It's funny, because most of the time the kids are putting Band-Aids on the parts of their body that are dysregulated, right? And so they'll put the Band-Aids on, and we'll say, okay, what are some ways that we can take this pain away for them right now? Can we do breathing? And so then we'll practice our breathing strategies. And every time that we breathe through that part of their body that's then feeling more relaxed, we'll take the Band-Aid off. You know, so goofy games like that, where we're incorporating like a third person, so that they're not having to they don't really understand a lot of that in themselves, but they understand it in others or in toys. So that's one way that we'll use a lot of play like that with stuffed animals and different games, label different feelings, that kind of thing.
And you were talking about the strategies earlier, when you get the kids to run, and then you get them to then try to practice lowering down their heart rate after that. So you're kind of doing the same thing you talked about with yourself, where you're using like your prefrontal cortex to try and override some of the extra effects that you're getting from your nervous system. Is that part of that strategy, is intentionally trying to get them to think and focus on things and cognitively try and change their perception of stuff?
Yeah.
If you think about it like this, to oversimplify it, if your limbic system, if that emotional brain's on to a certain level, to a high level, your frontal lobe's off. So you wanna flip the switch to your frontal lobe being on, which is a lot of what cognitive behavioral therapy is. Which isn't, we do a lot of that CBT training with reshaping your frontal lobe and getting that to be more active. But our mental health therapists do EMDR and other things to help process therapy. But that's exactly what it essentially is you're trying to get that pathway to hit the frontal lobe first, so you can problem solve and use executive function to override that sympathetic response. I mean, it's like neuroplasticity 101. That's all it is. We just want to kind of reroute that brain to think more, because I always tell my kids, your body doesn't control you, you control your body. And then we work on that breathing to kind of slow down your heart rate and decrease all those sympathetic symptoms. If you were to, just to touch on the healthcare field, if you were to think about trauma, it would be trauma is essentially at its core something that happens to you that you can't really respond to, right? And you can plug and play anything you want in there. So if something happened to you and you couldn't respond to it, and your brain goes essentially into protective mode, it rewires to protect yourself. So you have a traumatic experience, you have neurological rearrangement, like cortical reorganization to protect your brain, which also includes that it's that high sympathetic state, which includes low dopamine, low serotonin, low protective response. And so now you're at kind of a low state. And where the health comes in is, in order to kind of bring up those serotonin and dopamine levels, you often engage in riskier, unhealthy behaviors, alcohol, that dopamine rush, sweet, salty, fatty foods. We know that also raises dopamine. So you engage in smoking, you engage in impulsive behaviors. I mean, that's where the health also gets compounded, because you have dysfunctional coping skills. Instead of getting that dopamine rush from exercising or a walk or community, you need it quick, and those aren't long lasting. So if you think about alcohol, for example, you drink, you get that dopamine rush, and then it actually depletes your dopamine, rinse and repeat. So that's where we see those unhealthy behaviors leading to health consequences as well, which then can lead to social isolation and unhealthy relationships, because you're constantly trying to change the neurochemistry in your brain. So that would be more of how trauma can lead to long-term health issues. So I think that's the most simple way to think about it. So if we continue down a road where we're very symptom-based, the problem's not going to really stop. And I really think part of the reason this happened, I think depression's up, suicide's up, all these horrible things are up. And I think it's because we forgot about resilience. You know what I mean? We're a very coddled society, and that's probably not the greatest thing to say, but we forgot how resilient we are. Not to put down anything, but we are very, very resilient. We are designed to be resilient. We're designed to survive. So I think instead of emphasizing the symptoms, we need to emphasize our resilience and deal with the trauma, but know that that's not going to define us. So that's kind of the trauma lens.
Yeah.
You say?
Yeah.
I think that's a good point, but I think also people might not be aware that trauma has affected them in so many ways. So I guess, when does it come to a point where that you can either bring that to their attention, or like have people cognitively know, like, oh, this is what happened to me. And that's
Yeah.
the reason why I'm drinking so much. But I think usually people are like, I just need a drink. And then that's the solution. And that's what they're like, I'm fine,
Right.
Yeah.
quote unquote, right? But it's really not fine. They just
Yeah.
haven't dealt with that yet. But I guess how do you identify that, or let someone know, like, hey, maybe to bring that self-awareness, if you will?
Yeah, that's a hard one, because I think people have to be, the behavior has to affect their life enough to where they're saying, like, I want something different at some point, right? Or I'm going to seek out something different. I know in the therapy world, it takes a long time, because even when you say, okay, I'm ready to go to therapy or confide in a friend or whatever, it takes a long time to build that trust and rapport with somebody where you're going to start to talk about that stuff. And so it's not an overnight fix. It's very trust based. So I don't think there's a quick answer for that, like
Oh,
they
absolutely.
don't come into the office and then just start spilling all the things, but they'll start spilling all the symptoms, gosh, I'm in crisis, I always have conflict, and I'm drinking a lot or whatever. It takes months to get to the root of it, but that's the goal. Let's get to the root of it so that we can figure out how to change it.
Right.
We talked a lot about the different things that are going on as far as issues or different kinds of conflicts, whether internal or external. What do you recommend that we would do about some of these?
I know as far as, one would be teaching healthy coping skills from the beginning. It's kind of like what Erica was alluding to is, when you mentioned the alcohol, something might be wrong. I think first it's recognizing there was trauma and teaching healthier coping skills for that. In getting a kid being on screen all day, that needs to be a universal a universal acceptance that unlimited screen time is not going to be healthy for a kid, especially if they've had trauma. They need to learn to cope and express and process.
Yeah, and I mean, just awareness in ourselves, I think too. Like we were kind of talking about, like, how do we get to the place where we know maybe if we have a dysfunctional behavior or a behavior that we're not proud of, kind of looking at internally and saying, like, why am I doing this? What happened that's causing this? And the more that we can be aware of ourselves and then the people around us, and not just looking at it as a symptom, but like, oh wow, what happened to them, and kind of how we work with people like that. I think that's the most important. So I think that's just why we want to bring awareness to it, because I think it's a piece that we're missing. A lot of people are missing that background on looking at trauma and what it looks like. So
Yeah, Danny, you bring up a good point. Not only kids, though, I think adults can.
Yeah.
So we don't have the screen.
Yeah.
You look at the screen, there's like a little notification you can get on your phone, and they say you have been on your phone for X amount of minutes
Right.
or hours. Likely it's hours for me, unfortunately. So now I'm looking at it, I'm like, oh man, I gotta bring that down.
No, and obviously I'm guilty too. I'm just get to sit here and mock everything, but I'm as guilty as everyone. So I think that just being aware of getting to a place where we could recognize dysfunction versus functional too, I think, and bringing that into the healthcare field as well. Is this pain or is it trauma? Are you are you engaging in these behaviors that increases that risk? And if so, let's not help the behavior, let's take care of the underlying problem. Having behavioral health therapists more so in hospitals to address that, I think that would be a huge thing. Because we can't just keep pumping people full of drugs. We have to, as you guys know, I mean, your fitness, your fitness nuts. So I think that getting people more involved in taking care of themselves with healthy means is a huge step forward as well.
Yeah, and looking at the models too, it's just tough too, because time is what it takes,
Yes.
right? As your treatment protocol, right? It's, as Carly mentioned, it doesn't happen overnight, happens over several months and sometimes probably years, I'm guessing. But yeah, I think if you look at the model, it's hard to say because you only have X amount of time with, your provider,
Right.
Yeah.
which is understood. Like there's only, we have to make sure we can help as many people as you can, but also look at how much time can you spend with one person. And that's a lot of detail to go into somebody if they're experienced that. It's like not something you can just help one person one time and then you never see them again. It's usually like the continuity of care is where we hope to have.
Yeah, it's an uphill battle for sure. Definitely.
Well, we really appreciate your time, and thanks again for being on our show for the second time.
Yeah. Thank you guys
No
for having
problem.
us.
Thanks for having us.
Thank
Always
you,
a
guys.
pleasure.
Yep. And we'll put all your contact information in the show notes so people can reach out to you if they need anything.
Perfect. Thank you
All
so
right.
much.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast or any combination of the three. Thanks again, and remember to take care of yourself.